On this edition of Veterans Health Watch, we'll be talking about how Maryland's veterans can take charge of their health care, becoming leaders of their Patient-Aligned Care Team, or PACT. Join us as we share tips on meeting with your primary care provider, updates on VA pharmacy services, and information on managing chronic pain. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. The men and women who have served our country have access to high-quality clinicians and a variety of healthcare services through the VA. But it all starts with a veteran's first primary care appointment. Here joining us to talk more about how a veteran gets started is Dr. Martin Garcia-Buñuel, the Deputy Chief of Staff at the Perry Point VA Medical Center. Dr. Garcia, thank you so much for joining us.
Thanks for having me.
And Dr. Garcia, for those veterans who are currently receiving primary care through the VA, they know what a PACT team is. Could you please explain this term for our new veterans?
So PACT, Patient-Aligned Care Team. Some people may refer to it as the patient-centered medical home, but with the VA healthcare system, the PACT team is the team that is there to take care of the veteran. And that team is made up of a primary care provider, a physician or a nurse practitioner usually, a registered nurse who does care coordination, a licensed practical nurse or health technician who also provides a lot of healthcare support, as well as administrative staff who surround the patient. And then many times, based on the needs of the veteran, that PACT team can include other professionals, mental health care professionals, social workers, a physical therapist, you name it, whatever the veteran needs, we'll include in the PACT team.
It's a pretty comprehensive list. We'll get into that a little later. But when is a veteran assigned to a PACT?
So when the veteran comes for their first appointment, they'll meet their PACT team. And so it's not just meeting that provider that's going to be taking care of them, it's really meeting that whole team. And many times it is that nurse or administrative person or other member of the team that's right there with them. But at that first visit, I think most veterans will find it's that time where they meet that provider and really start to understand who that team is.
When we talk about the veteran being a part of the team and a part of their own healthcare experience, what do you mean when you want a veteran to be a leader of the PACT?
Well, we really think of the team as really built around the patient. And in many cases, once the veteran realizes just how important they are in that team, they really do become the leader, because we try to drive what we do based on the needs, the desires, the questions, the thoughts and concerns of the veteran patient.
And we want the veterans to maximize their time with the team. So what can a veteran do to prepare for that first visit?
Well, that first visit is definitely an important one, because that's when the veteran's going to meet that very important group of people. We want the veteran to come prepared, and that can be with information they're bringing in about certain medical conditions they're already aware of, medications they may be on, information about other doctors and other providers they may be seeing, if there are significant medical records, test results, things that they want to share with their team at that first visit. Very, very important, as well as important people in their lives, so family members, caregivers, if they can come along as well. We also want them to come prepared to tell their story, if they feel comfortable, or however comfortable they feel in that first visit. Tell us who they are and what their goals are for their health and the future.
And I know a doctor's visit can be a little intimidating or uncomfortable, a little embarrassing even sometimes. What would you suggest a veteran remember for that first visit?
Well, as much as possible, and that's what I refer to when I say tell your story. Being open, knowing that time with any member of your PACT team is private time. It's that time where you maybe can talk about some things, ask questions about things, or share some feelings or thoughts that you may not do day to day in other settings. But that privacy, that confidentiality, and that trust to try to let us be there and play that role for you on that during that first appointment and appointments thereafter.
And thereafter is what I was getting to next. What advice would you give a person after that initial visit? You've met your team and now you're moving on throughout the healthcare system. What advice would you give someone after that initial visit? What should they do?
Well, I think at the end of the visit, once again, there should be some kind of plan that they feel comfortable with. And that they've been able to ask questions, they understand what follow-up may be, what kind of tests may be ordered, what kind of medicines. And then as they come back for those subsequent visits, once again, it's a chance to, keep telling your story. What's happened? Have there been changes? What's going on with treatments or testing? Have there been side effects to things? Have there been other events in their life? So keep telling that story, and many times that story can have specifics related to health and wellness. So we always want the veteran to come in, and once again, if there's someone who can come with them that can help bring information or help continue to provide the support that they need, please make sure, we want them to bring them in as well.
That's a great point, to walk away with knowing what is expected of you. What am I supposed to do next? What medication do I need? I think that's a great point, because you kind of walk away and you forget. So to walk away with that treatment plan is
and
smart.
to reflect on that statement, we also want to make sure that we know what's expected of us. And so it's very important for our veterans to know that this is a two-way relationship, and it's a two-way relationship that starts with the patient. And so that's why that storytelling, asking questions, even making lists, so that we know where the patient's coming from, and so we know how to help them and support them in moving forward.
And speaking of moving forward, we know after a visit, the patient may need more than just a primary care appointment. How does the PACT team travel with the patient throughout their healthcare experience? Well,
so we make sure that we know how the patient can get in touch with us. So we always make sure, once again, how do they contact us? Specialty care appointments can be very common. We are the point of contact for those specialty care appointments until they're scheduled. Questions about medications, we are the point of contact, and then we can help refer the patient if we can't answer the question, make sure they get to where they need to get the answer, the question answered.
Yeah, I think that's another great point, just great advice, especially knowing how you can get in touch with your team so you can follow up on all those points. Before we go to break, is there anything else you would like to share with either the new veterans who haven't had that first appointment, or veterans who are active in the system but maybe they need a little refresher?
Well, I think you raised most of the important points, but we're spread throughout the state of Maryland. We have primary care offices throughout the state of Maryland, so we want to be there for our patients. We want to be close to their home. We want them to be able to come and see us. We want them to have access to us, and that access can be face-to-face as well as by telephone, secure messaging, other technologies that we do use regularly. And we really do want to meet our patients. We especially want to meet those new patients who may not be familiar with us, and we want to show you what we can do for you.
Sounds good. Thank you so much for being with us, Dr. Garcia.
Great. Thanks for having me.
We're going to take a short break, but when we return, we'll have an update about VA pharmacy services, so please stay tuned.
The Appointment Call Center is a fast, easy, convenient way for a veteran to call in to schedule, change, or cancel an appointment.
You can reach any of us by calling 1-800-463-6295, extension 7333.
The call center is open Monday through Friday from 7:30 a.m. till 5 p.m. If you need help scheduling an appointment, call the call center because we're here to help.
Welcome back to Veterans Health Watch. On this episode, we're talking about taking charge of your health care, and often a component of that is managing your medications. VA Pharmacy Services is available to help our veterans do just that. And joining us to talk about how the VA Pharmacy Services helps our veterans is Dr. Eugene DeLera, the Chief of VA Pharmacy for the VA Maryland Healthcare System. Dr. DeLera, thank you so much for joining us.
Thank you.
Please give us a brief overview of the VA services for our veterans.
Well, thank you, Kenya. Well, in addition to being the Chief of Pharmacy, I'm a 24-year Navy veteran, so I come at this with that perspective. We process over 1.5 million prescriptions each year. And for those veterans who are hospitalized, we do another 500,000 prescriptions or unit dose medications, IV, parenteral products, chemotherapeutic items, various compound items for our veterans. Doing all of this work, we have about 110 pharmacists and technicians spread out at Baltimore, Lock Raven, and Perry Point, as well as the outlying community clinics. In addition to that, we have 30 advanced practice clinical pharmacy specialists involved in disease state management, anticoagulation, geriatrics, sundry various specialties, infectious disease, and they're doing tremendous amount of work, patient and family-centered care, and we're very proud of them.
I'm glad that you explained pharmacy services in broader terms. Usually we just think we go get our prescriptions filled, the doctor writes a note, and we're gone.
Absolutely.
But it's great to hear how involved pharmacy services is throughout the healthcare system. So what advantages are there to using the VA pharmacy services to refill or fill a prescription for our veterans?
Well, the most obvious one is low cost or no cost to our veterans, and it's based on their service-connected disability, but also quality. You know, we have to follow the Drug Supply Chain Security Act, where we make sure we track those medications from cradle to grave or from manufacturer to the actual dispensing. So that's very important. But also, more importantly, is the safety. So we encourage our veterans to use one pharmacy, but all of the computer systems are integrated as long as you're going to the VA. But we're able to make sure that there's no duplication or any drug-drug interaction. So it's very important that you just use one VA, one VA pharmacy.
Right, for that continuity of care.
Continuity
Sounds
of care.
awesome. What if a veteran has a prescription from a non-VA provider? Can they still come to the VA to fill that prescription?
Yes, there's generally two scenarios where that would occur, and that's the VA choice, or the fee basis, or we call care in the community. But essentially, you would have authorization through that process to get those prescriptions. But we're able to fill those prescriptions that are in those programs.
So let's talk about the process for a veteran. How would a veteran get their prescriptions filled or refilled at a VA pharmacy?
Okay, well, the new prescriptions are typically at our main facility at Baltimore or Perry Point. And then the refills are done through the mail-out pharmacy. We're required to do at least 80% of our refills through the CMOP, the Consolidated Mail-Out Pharmacy. But also, there's ways we understand our veterans have different levels of comfort with technology. So the easiest way is to just drop the slip into the mail and request that refill. But also, you could do it by online on the computer, My Healthy Vet, and I'm really a proponent of that because you can check the status and the tracking of the mailing of that refill. And then, of course, you could do the telephone refill line, which is quite easy as well, and all that information is on the label.
Yeah, I'm a proponent of the telephone refill line myself. You get the information right there when you get your prescription. You can call and
Quite easy.
refill. Pretty simple. Yeah, you don't always have to drive to one of the medical centers to
Yes.
get your refills. I think that's a great system. And you hear the term formulary when you talk about what medications are available through a pharmacy service. What is a formulary?
Yes, Kendra, that is confusing to some people, but I look at it this way. It essentially is a list of drugs that are authorized for general use. And so long before I joined the VA, each VA and clinic had their own formulary. So roughly about 20 years ago, they standardized the VA national formulary. So no matter where that veteran goes, if they move from one state or one city to another, and there's a VA, they're going to have the same exact formulary. So it's just a list of drugs that are available.
What do you do if a veteran needs a medication that's not on that list, on that formulary?
Okay, generally, well, we encourage use of the formulary, but with direct-to-consumer marketing that you see today, there's a difference between need and want. So that's a discussion between the veteran and his or her provider. But then there's evidence-based justification that would be put on that request to the pharmacy. And if it's justified, evidence-based, again, it would be filled.
Through the provider?
Through the provider,
Excellent.
Yes.
And how are co-pays for medications determined?
As I mentioned earlier, it's service-connected disability. So they would go through that compensation and pension process to get evaluated. A service connection is determined, and then the co-pays would be associated with that. No one pays more than $9 for a 30-day supply. So it's quite a bargain. I know the cost of drugs today, and the veterans are getting quite a deal.
Great, as they should. Yeah. And how long does it generally take to get a prescription refilled or filled?
Well, two different processes, but filled, again, at the main pharmacy, our wait times probably run around 20 minutes. The VA standard or threshold is 30 minutes, and we are always consistently beating that time. Now, as far as refills, which again come out of the consolidated mail-out pharmacy, we say it takes about 7 to 10 days, and this is what we're seeing. It runs about that amount of time. But we give these tips to the veterans. As soon as you get your prescription or your refill, go ahead and request that refill. And then the CMOP won't send it out until most of your existing medication is gone. That way you won't have any gap in your prescription.
And you don't have to remember to do it.
Exactly.
Just go ahead and do it when you get that prescription. But as you know, sometimes that doesn't happen. So what should a veteran do if he or she runs out of medication?
Well, we always discourage veterans from running out of their medications, but we know life happens. And when that occurs, we also remind veterans they don't necessarily have to come and see their provider. So if their condition is stable and they have current labs or what have you, their provider may just be able to enter that new prescription and send it to us. If the veteran, if it's that case, and they could just mail it right to the veteran.
Okay. Well, we're going to take a short break soon, but I have a few more questions.
Okay.
So what should a veteran do if they're on multiple medications? What's available to help them manage those medications?
Well, I think Dr. Garcia mentioned earlier as part of the PACT team, one of the things we encourage is creating a list of your medications. That's one of the simplest things to do. Have each item listed, how often you use it, what it looks like, how frequently you're supposed to use it. That goes a long ways as far as managing when you have multiple medications. Now, sometimes when you have a lot of medications and the veteran's still struggling with that, you can contact the pharmacy. There's these 7-day pill organizers that help out. But one of the things I always encourage veterans is to know their medications. Don't just say, well, my purple pill or my little white pill. I think they should know their medication and what it's for, and that really helps out with keeping those things sorted out.
Again, like we said, this episode is about taking charge of your health care, so you need to know what those medications are. But Dr. DeLera, like I said, we're going to take a short break. Last question, what about health care, your partnerships with folks in the community or other pharmacies in the community to help those veterans who are maybe in our outlining areas, in the rural areas? Tell us about that program.
Oh, good question, Kenya. Thank you. So there's a new program that's been in place about a year and a half. It's called the Heritage Health Program. So out on the Eastern Shore, Southern Maryland, the clinics out there, if they see patients that need urgently or emergent needed medication, and that veteran say cannot get to the main pharmacy, we could overnight it, but sometimes that's not even good enough. So the Heritage Health Program, they're able to provide a prescription and a voucher to that veteran, and they could take it to the local retail pharmacy. Great. So that's been a tremendous benefit, and the VA is looking at expanding that VA-wide. That's going to be a tremendous thing if that happens.
Access to health care.
And there's no cost to that.
Yeah, that's even better. Thank you so much, Dr. DeLera, for being here with us and for all the work that you and your team do to help our veterans.
Thank you, Kenya.
We're going to take a short break, but when we return, we'll talk about managing chronic pain, so please stay tuned.
The VA Maryland healthcare system pharmacy is second to none. The copay is minimal. The wait time is as good as you would find in a civilian pharmacy. There are various ways our veterans can access pharmacy services. One is just come to the window with their prescription. Two is through a My Healthy Vet, the internet. They can get their prescription through the phone or through our consolidated mail-out pharmacy. We're very proud of our pharmacy services. We're patient-focused, and we want them to come and see us and what we can do for them.
Welcome back to Veterans Health Watch. Chronic pain is something that many Americans deal with at some point in their lives. Joining us to talk about how to manage chronic pain is Dr. Carol Bowman, a lead physician at our Residential Wellness Center at the Perry Point VA Medical Center. Dr. Bowman, thank you so much for joining us.
Thank you for inviting me.
Let's start by asking you to describe chronic pain. What is chronic pain?
So the first thing to understand is that pain is part of our normal survival response. So pain has a purpose. So acute pain, short-lived pain, is something like you stub your toe, you get stung by a bee, it sends a signal, and then it resolves. Chronic pain is pain that lasts a longer period of time. So for example, if you break your leg, it might take 6 months to completely heal, so that pain would last 6 months, but you know you're going to get better and it's part of the healing process. Then there's something called chronic pain syndrome, and that's a more complex issue. That's where you have pain that has no function. Your body isn't healing anymore, you don't have an injury. It's part of that survival signal, but the signal just keeps going and the pain doesn't serve a purpose anymore. And it's physical, mental, emotional, spiritual, social, and that's a much more complex issue.
I've never heard of chronic pain syndrome. Thanks for explaining that.
Sure.
Is there a type of chronic pain that's more commonly seen in the veteran population?
Well, there are some patterns. In the military population, there's a lot of musculoskeletal issues from being in the military and jumping and marching and, a lot of those kinds of things. The more complex piece that we see a lot and why we see a lot of this chronic pain syndrome is when there's a traumatic event associated with pain, like being in an explosion, or when there's a big emotional charge, when there's an emotional and a physical event that get combined, and that's when there's a lot of lingering of the symptoms, so we do see a lot more of that as well.
Maybe if you could help us understand what the word syndrome means. Why is syndrome attached to this ongoing chronic pain?
Right, so a syndrome describes something that's complex. So like I said, somebody could have arthritis in their knee and they just have arthritis in their knee and they manage it by how they live their life or how much they exercise or how much they stretch, but it doesn't really take over their life. So chronic pain syndrome is a more complex issue, and that's where pain really becomes the focus of somebody's life. So it in a way, it hijacks somebody's life. They are constantly seeking pain relief. It affects relationships. It affects finances. It might affect work. There's an emotional upset associated with it. So it's really when this chronic pain takes over somebody's whole focus of their life.
And so I'm sure there's a difference in treating chronic pain versus chronic pain syndrome. What's the difference? As a doctor, how do you treat those things differently?
So yes, there's a big difference, and that's where there's some confusion really in the medical community in general. So chronic pain is a management issue. So that's where you could have pain management. For example, if you have arthritis, you might need periodic steroid injections, something like that. Because chronic pain syndrome is the biopsychosocial model, it involves a traumatic event. It's when the physical and emotional become linked, and that's a physiologic. So in the brain, emotional pain and physical pain become linked. So when someone has pain, they're upset. When they're upset, they have pain. It affects their life. So you have to address all aspects of that syndrome. You have to address the emotional upsettedness associated with the pain. You really have to take a holistic approach to chronic pain syndrome, and we actually call that pain recovery. We don't call that pain management, because in a way the person has to learn a new way to live so that pain isn't the focus of their life. And you do obviously use physical modalities, but you also have to use mental, emotional, spiritual, social modalities.
And I know the VA is leaning more toward the holistic approach to care, treating the whole person and everything that's involved in their healthcare issue.
Exactly. So this is really a perfect fit for that kind of approach. And one of the problems is with medications, because generally people think, oh, well, if I have pain, I just need a medication. But with chronic pain syndrome, medications have limited benefit, and sometimes they can actually be counterproductive. For example, with taking chronic narcotics and opiates, they actually cause decline. People get worse over time instead of better, so you really have to take a holistic approach.
And we talked about earlier in the show the PACT team and the whole team approach to healthcare. So that's another reason why it's so important to stay connected to your health team, your healthcare team.
Exactly.
Yeah.
And there's PACT teams developing around the nation, and we have a program at our residential wellness center, and it is a team approach to chronic pain syndrome, working with cognitive behavioral therapy and psychologists and acupuncture and mental health recovery partners and physical therapists. And we've started doing some battlefield acupuncture, which is ear acupuncture for pain. People can do biofeedback. There's a lot of approaches, because remember, pain as a survival response is when your nervous system is overactive. Because if you're getting eaten by a tiger, you need an overactive nervous system, and then you calm down. In chronic pain, when you have that chronic overactive nervous system, you have to figure out how to calm that nervous system down, and a lot of that is thoughts and emotions as well.
So what about the long-term effects of untreated chronic pain? We have people who just tough it out and say they'll deal with it. What do those long-term effects look like?
Well, again, if it's chronic pain, for example, some chronic knee arthritis, obviously people just want to manage and improve their health as much as possible. But untreated chronic pain syndrome, people get depressed, they have insomnia, their relationships have problems, they have financial problems, they basically become homebound. So it really does need to be addressed, because it's just a slow decline otherwise.
This has been a very enlightening conversation, Dr. Bowman. Before you go, we have one more question. What would you say to a veteran? We know our veterans are tough. They're trained to be tough. They can endure a lot. They've endured so much over the years. What would you say to that veteran who says, okay, I can tough it out, I can deal with this pain, and they don't seek treatment?
Well, the interesting part is they can take those skills of resilience and persistence and actually use those skills to get well, because believe it or not, it takes more courage to get well, because that involves change, and it's easier to stay sick. So they can really utilize those skills that they have to kind of dive in and figure out what to do and get some help and really have a better life.
And the VA is here to help them.
Yes, definitely.
With the team like yours
Correct.
at the Wellness Center. Thank you so much for joining us. And again,
Sure.
this has been a very enlightening conversation. I'm sure our viewers have enjoyed it as well.
Great, thank you.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please give us a call or visit our website at maryland.va.gov. And remember, you can also follow us on Facebook or Twitter. And if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please give us a call, visit our website, or visit one of our VA medical facilities. We look forward to serving you. Please join us next time.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege to me to be there, because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really, really gives me an opportunity to give back, make a difference.